Hi, this is Terry QT. Welcome to the Deep Sea Foundation educational channel where we talk about all options of breast reconstruction and topics related to breast reconstruction and breast cancer. I want to welcome my guest today, a very good friend of mine, but also a fierce patient advocate, Kirstin Litz. Kirstin, welcome to the Deep Sea Foundation channel.
Thanks, Terry. I'm glad to be here.
Yeah. Kirstin is the current chair of the HERS Breast Cancer Foundation in the California Bay Area. Wonderful organization serving breast cancer patients with a number of services. She also has done public speaking at medical conferences and has raised thousands of dollars for breast cancer awareness. She is also a multi-year breast cancer survivor. And I'm going to define multi-year by we had our reconstruction almost at the same time, Kirstin.
I know that's kind of crazy to think.
It is crazy to think about. And we have been on this journey together since we were Leeds graduates in 2017. I'm so glad that I got a chance to meet you and we became good friends. So I'm so glad that you are on the program today. And I'm going to tell everybody why. This was a whim on our part. Here we are in May 2020. We are both sitting in our homes. I really want to just like jump through the screen and give you a hug because
I take it.
I know we're right in the middle of the coronavirus and shelter in place. Seems like our West Coast Alliance in California, and I'm up here in Seattle, we are, hitting it strong and staying in sheltered in place. But the reason that precipitated this video today, we did it just on the spur of the moment, is you just had your telemed conference with your oncologist.
I did. It's kind of surprising that we've been sheltered in place, or I have for the past 2 months. So this was the first medical appointment that I had. And Terry, let me tell you how it all went, because it was a new experience for me. Last week they called to confirm the appointment. I have a landline still, plus a mobile phone. My landline I use as an answering system. So when they told me that it was going to be a video call initially, I'm like, well, that's not going to work on that phone. This week I got a phone call to confirm my appointment. I also got a couple of emails. And I also had a note in the application that Stanford uses to contact patients. Okay. And the thing that I found interesting is everything wasn't completely in agreement. So the phone call I got this week said someone would call me before my appointment, on the day of before my appointment. Then I looked at the online email and it said my appointment was excuse me, at 9:30, but I needed to log into the application excuse me, at least 15 minutes early to make sure that everything was working,
lined up.
Yes. And but my online appointment inside the Stanford My Health system said my appointment was at 9:15. So I thought, okay, at 9 o'clock, I'm going to check things. Well, as I was checking things, my home phone rang. So I ran to grab that, but they hung up before I got there, and my cell phone started ringing. And it was the front desk type person to check me in and to make sure all information hadn't changed. The generic stuff that usually you do when you check in. Mm-hmm. And she said, okay, log into the app. And I mentioned I had already been in there, and that what happened initially is I was using the online version, and it kept kicking me out. So I downloaded the versions because the one thing is you don't want your appointment interrupted. So I was like, I'm making sure I only go every 6 months. So it's an important appointment. It's not something that can be missed. So shortly after that.
Here you are in the virtual waiting room.
Yes, exactly. And the best part about the virtual waiting room is you can do other stuff. I could do my work while I was waiting, so I didn't feel like I was just hanging around. The PA came on, and she and I went over a bunch of questions, checking more detailed. In February, I had been in the emergency room, so that she was making sure that I hadn't had surgery or anything like that. If I had any surgery scheduled, the generic stuff. The one thing I did find interesting when I was checked in initially was the woman asked about my height, my weight, and could I take my blood pressure? I don't have a blood pressure cuff at home, so that was a little bit strange.
Mm-hmm.
PA was on video with me, so I got to see her. We had a nice conversation. Then she let me know that there was a few other patients ahead of me and that my doctor would be on shortly. So while I was waiting, I did some more work, and then there he was. And totally video, yeah. And he was sitting in his office, not at home like the rest of us. He is in the office because they need people to watch the infusion center for chemotherapy and things like that. So it was like a normal appointment, but without the hug that we usually get.
Right.
The small talk was still there and everything else. The appointment was probably about the same amount of time as a regular appointment. He checks to make sure my heart's beating. So I think since I was alive, he could assume that. Then when we ended, I asked about the next appointment because I have an appointment in 6 months, and he said someone would call me this afternoon to set that up. So I'm waiting for that. But I think being prepared, making sure that the video was good, I got the most out of it. I had a few questions, so I had written them down so that I could ask them, and it went really well.
This is interesting. I think this is going to be a different experience for, each patient, but you brought up some very good points, I think, in that coordinate the times that you're getting, because yours were a little bit conflicting. And I have to preclude this by saying this is a learning curve for all of us. I do know there have been a number of surgeons, physicians that have been using telemedicine for quite some time. But now it might be the new frontier, not just for the short term, but because of the coronavirus, this might be something that stays in place for quite some time. So I think that not only the medical profession, but also patients also have, kind of a learning curve to fine tune it. You brought up some really good points today in that you have to be ready, know which apps. The one that you were talking about, Kirstin, it sounds to me like it was patient confidentiality specific with your particular healthcare system. Am I correct?
Correct. Or you launched it via their site. So I think that yes, there's an extra layer of security in there.
So, just stating clearly here, and why, part of the reason I chose you to be on the Foundation Advisory Board, you have such a great IT background, and the fact that you're a breast cancer survivor, you have a lot of technical savvy. What about for those people that maybe don't feel comfortable using online platforms? What's the best piece of advice you can give them?
It's not, the one thing is that I was trusting of it because it was via the application that I can use to check my medical records and other things online. So I knew that it was probably safe. The one thing, though I am tech savvy, I still wanted to make sure everything worked because I didn't want there to be anything that created a glitch that ate into my appointment time, because I knew that, things are probably back to back for my doctor. So just like when we're in the office and we sit around and we wait because somebody else is late. Well, I didn't want to be that person. So I checked everything. I made sure whatever information, like yesterday, I could check in yesterday and go through like my address, the pharmacy I use, some of the other, what medications I take and things like that, just verify those kind of things so that those things didn't take any time. Those questions were already answered. So I was prepared so that I would get my full amount of time with the physician, which I think to me is important because since I only see him once every 6 months now, if I did have some questions, I mean, we did talk about my trip to the emergency room and, some life changes, certain things that I can't eat, like popcorn anymore. So yeah, that was a nice, I knew that, but it was nice that we chatted about that as well as my other health.
Yeah. I'm curious, did your physician oncologist make any remarks at all about the new experience that he had with you with the telemedicine, just out of curiosity?
No. I mean, we joked around about the fact that we both had dual monitors and how he was spending his life. One was the patient record and then the other one was watching the infusion room because he's stuck in his little office all day.
Well, you gave some great, valuable information. I really appreciate you doing this really on the spur of the moment, but it seemed like such a teachable learning moment for the viewers because in breast reconstruction, in my corner of the world, in my advocacy, I know that there are so many plastic surgeons that are using telemedicine for their conferencing now to schedule surgeries, to talk to patients, and probably for those that don't need any hands-on physical examination, they can also do follow-up procedures too. So that really appreciate your time in sharing all this with us today, and hope we get that hug soon.
I agree. I have to add this too. I think the one thing that it did is I realized at another portion today, the stress of people touching you and sharing air and things. And that was the one thing I didn't have to worry about going to some place that I might get infected. I feel very safe at home. And yeah, not that I expect that I would, but it just had that comfort of being in my own home, that I was safe. And that's important, I think.
Yeah, you pointed out a lot of pluses, which is good. And I think that's that's what we have to look at now, are the pluses that are coming out of this, because goodness knows it's been a challenge for all of us, patients and physicians alike. So really appreciate your time today and doing this on the spur of the moment.
You are very welcome, Terry, anytime.
All right. You're always a great advocate. And please like and comment on anything that you have questions on today in the video. And let us know if there are any other topics we can cover for you on the Deep Sea Foundation educational channel. Thanks, Kirstin.
Thanks, Terry. Stay safe.
All right. You too.
All right. Bye-bye.
Bye.